We're going now to Florence, where Bridget is on the line. Hi, Bridget. How are you today?
Hi, I'm well. Thank you for taking my call. I appreciate it.
Yeah.
I have a 6-year-old spaniel mix. She looks a bit like a King Charles. We picked her up from a kill shelter about 4 years ago. She's a wonderful dog. The only problem we have is she has huge separation anxiety issues. Cannot leave her in the house. She will defecate, urinate, tear things up. So we started kenneling her.
Right.
And we have to keep her in an enclosed plastic kennel because if we put her in a wire kennel, she'll just tear up her paws. She actually broke a tooth in her wire kennel. She salivates like I've never seen an animal salivate. There'll be a puddle of it outside of the kennel. We actually have to keep a towel underneath the kennel. It's really, I hate it for her. I hate to have to do that to her, but it's really for her own safety and for my house.
Right.
But is there anything that we can do? I hate to medicate her. I don't like to leave her if she's on anything. She's in the house by herself. And we've tried the whole, doing it in increments and getting dressed and walking out the door and then coming back in. And
right. Good.
it's just nothing is working for this dog.
Okay.
Right. Well,
I was hoping you have a suggestion.
Well, and that's one thing where you go from, one frustrating problem to the other, and that's, the two things. That's why we get a lot of calls on skin things and behavior things,
Right.
because both of those are very frustrating.
Right.
And separation anxiety is certainly one of the very frustrating things. And so, commend you. First off, don't feel bad about the kennel because one of the first things, that we've got to get across to her is that she has a safe spot.
Right.
That, and that's what the kennel needs to become. And so we need to use the kennel not just when we're gone. Use it when you're home too. Use it at night. Use it other than just when you're leaving. So that needs to be her bed she sleeps in. That needs to be her safe spot. And then the things you were talking about doing things in increments and leaving out of different doors, doing things differently so that you don't give her those triggers to key up on as far as that you're going to be gone. Doing those, making sure that we that there's not a big deal about leaving. That we're not telling her, oh, good girl, it's okay, we'll be right back. And then make sure we don't make a big deal about when we come home
back,
either.
Yes, right.
So that there's nothing that excites her about those things. Those are all the things that we do as far as acclimating and getting them used to things. But there are dogs who can't do that on their own. Just like there's people who have certain issues that maybe that you can't just fix with a little therapy or things like that. That you may have to have an added benefit for that. And so, and especially if we've got one that is self-destructive, where we've got where paws bleed, where we lose a tooth, where we're having these behaviors like that. Those are ones that you really, really, really need to have on some medication. And when we talk about medication, like you just alluded to, that you don't want to medicate her and just leave her there by herself. That's kind of the wrong way to think about it, because we're not. The idea is not to medicate her.
When you leave, when you leave,
right. Or with a sedative that's going to sedate her. What we want to do is we want to use a medicine that's going to help as far as the anxiety level goes and reduce that anxiety some, so that she can learn from those things that you're trying to do as far as the acclimation techniques and all.
So it's kind of like Xanax for dogs.
Well, no, not Xanax.
No.
Xanax is.
No, I'm just kidding. I'm kidding.
No, but we do use Xanax sometimes. But but Xanax is a drug that really, it will relieve anxiety, but you also get sedation with it, and sometimes a significant amount of sedation.
Right.
And we don't want her to be sleepy and forget that she's anxious.
Right.
We want her. We want to help actually on the level of that anxiety, and so usually. You're using drugs like, there's a dog version of Prozac. Sometimes we use the human generic of it. There's some others that are, clomipramine, which is Clonacalm. Use sometimes older ones called Elavil. And so those drugs are a few different classes of drugs there, but they have a much higher potential as far as not sedating, and taking that anxiety away, so that they can learn that all those things are okay, and so that you can progress through those. And so that's what I would, get her into your family vet, talk about, having some medication to help you out with that. The other really important thing, like I said, can't stress enough, it's great that you're using the kennel, but we got to use it when we're home too. And she's got to sleep in it. It's got to be her bed. It's got to be her safe spot.
Right.
And so if it's just when she's gone, when you're gone, then it's just another trigger that, oh, I'm going to be in here and they're going to be gone.
Right.
And so, so do use it at other times too.
Right.
Okay. I'll have to try that. The moment the kennel door opens, she's just salivating and panting and if she thinks that means that they're going to be leaving, then that's just another trigger for her.
Right.
It's got to be her bed and her safe spot all the time.
Okay.
Right. And
well, that's good.
Well, I was going to say, and one thing that we didn't mention that we always mention is the pheromones.
Right.
That's something that's non-drug that you can use. They come in like a plug-in diffuser. They do make some collars and things like that too. But those can help relieve anxiety. The other thing that is not a drug, but some people think that they get a good response from, and some don't, is a thing called a thunder shirt. Typically people think of it as just a thunderstorm phobia to help with that. But it's the idea is that there's a feeling there that helps relieve them and feels like they're being held or things like that.
Right.
And so the thunder shirt or pheromones are certainly another step that you can do.
Right.
And you can do along with the medication too.
Right. And they shouldn't hurt anything.
No, they won't hurt anything. But but if she's having that self-destructive behavior, that is a big red flag that you need more help than just the acclimation.
Right.
You need to do those things, but she needs something else to kind of to bridge that gap to let her learn that those things are okay.
It wouldn't even have occurred to me that there would be anti-anxiety medications for dogs.
Right.
I'm glad to know that now, and I will actually call my vet and ask her about that.
Right, and like I said, we don't want to do anything that sedates her. We want to do something that helps her learn.
Helps her learn. Yep.
Right.
Okay.
Well, thank you. Thank you very much. I
you're welcome.
appreciate your
Thanks,
time today.
Bridget. Bye-bye.